So this is class 11 on asthma, cystic fibrosis, and lung transplants. For a lot of healthcare providers, asthma is actually considered a form of COPD. It is a chronic inflammatory disease. People are going to have the same issues with COPD with the inability to get air out of their lungs. So there are mast cells within the lungs. They produce histamine, and you're probably familiar. People who take antihistamines for allergic reaction and other inflammatory cells like eosinophils, T lymphocytes, and neutrophils. Asthma tends to cause chronic wheezing, chest tightness, coughing. Now, why do people get asthma? A lot of people get asthma just due to allergens, severe allergies, tobacco smoke, especially secondhand smoke that we covered the other day, occupational exposure to chemicals, pollution is a big part of it. There is exercise-induced asthma. We'll talk a little bit about that. And asthma does tend to run in families. The demographics of asthma. Asthma is highest in children, but they can outgrow it. So that is the only reversible type of pulmonary disease. So we talked with last class, most of the pulmonary diseases are progressive and tend to get worse out of time. So children can outgrow asthma as they get older. It is common across all races, but higher in non-Caucasians. More boys than girls. But interestingly, when we get to older ages, it's more adult women than men. So about 14 to 15 million people in the U.S., 100 million days of restricted activity. It accounts for a lot of hospitalizations, and 5,000 people die every year due to complications from asthma. And we keep seeing increases over the past 10 years, and we really don't understand why. Again, highest in minority populations, lower income, and inner city. And we talked a little bit about that in class the other day. Older buildings, pollution, lots of other factors involved. So if you look at this data, and this is from the CDC, asthma in the U.S. is now at the highest level. So the numbers are gradually going up, but you can see over the past 10 years or so, there is a gradual upward trend. And if you look at the data by race, age, and sex, you can see that children, about 10% of the cases, it does tend to, versus adults, once again, more females than males, and more African Americans and than Caucasian or Hispanic persons. So it is definitely highest in these populations. And what some of you were surprised at the other day in class and talking about that is asthma onset can occur at any age, and adults can develop asthma. So if you are working with a client or you know somebody that seems to have symptoms of asthma, then they may want to get checked out, especially if they're getting sick all the time. Chronic respiratory infections. I don't know if you know anybody, they seem to just catch every time of type of cold that comes their way. Women more so than men. And in looking at some of the studies as why this could be, is there somehow effect of estrogen due to pregnancy, due to menopause? But they really don't know why. Obesity is a factor, but definitely allergies, and particularly allergies to these things that are listed on the screen. Smoke, dust, cats, workplace, and feather bedding. And asthma has also been related to reflux disease. So it's sort of a chicken and an egg in that, people with asthma tend to get GERD. People with GERD also are at high risk of developing asthma. So researchers are not really sure what is the real reason for that. And they think it has to maybe something to do with common circulation throughout that area, common innervation through the vagus nerve, that, or that the bronchoconstriction also affects the esophagus, or vice versa, or problems in the esophagus also affect the lungs. That when people have reflux, does it backflow into the lungs, and that that also starts the asthma process.